I'll start by defining the public health issue, explain why it matters, discuss the consequences and action, then outline my proposed advocacy initiative with key components, and finally share what actions we can all take moving forward. I chose this quote because childhood obesity is one of the clearest examples of how environmental factors can limit a child's ability to thrive. These health issues begin early, and if we don't intervene, they shape the entire lifetime. According to the CDC data, about 1 in 5 children, roughly 14.7 million, are affected by obesity. The issue disproportionately impacts low-income and minority communities, where access to nutritious food and safe environments is often limited. Childhood obesity increases the risk of chronic disease at a very young age, diseases that used to be seen only in adults. Beyond physical health, children struggle emotionally, academically, and socially, showing this issue affects every aspect of their lives. The impact of children obesity extends across multiple areas of the children's life. Physically, children face higher risk of developing type 2 diabetes, cardiovascular disease, high blood pressure, and other chronic conditions at a very early age. But the consequences are not only physical. Obesity can negatively affect the child's emotional well-being and self-esteem, increasing the likelihood of social isolation or bullying. Academically, children with obesity may experience lower performance due to both physical and emotional challenges. In short, childhood obesity affects the body and mind and the child's overall health trajectory. Now, why does this issue matter for all of us? Beyond its impact on individual children, childhood obesity places a growing burden on healthcare system. According to the CDC, billions of dollars are spent annually on obesity-related medical conditions. This means that as obesity rates rise, so do healthcare costs and families, insurance systems, and government programs. But it's not just an economic issue, it's a generational issue. Children who experience obesity are more likely to become adults with obesity, making early intervention absolutely essential for long-term prevention. Without intentional intervention, childhood obesity rates will continue rising. If no action is taken, we can expect to see more children developing chronic diseases earlier in life, increased mental health challenges, and overall decline in quality of life for future generations. Prevention is far more effective and more affordable than treatment in school, where children spend most of their days, are one of the best environments for meaningful and sustainable change. My advocacy initiative focused on implementing a comprehensive school-based approach to improving nutrition and physical activity nationwide. This plan directly aligns with CDC Division of Nutrition, Physical Activity, and Obesity (DNPAO) mission to promote healthier communities and prevent chronic disease through improved nutrition, education, and physical activity opportunities. This first component of the initiative is improving school meals. Many schools still serve food at a higher in sugar, sodium, and unhealthy fats. To address this, I propose that school adopt stronger nutrition standards and increase access to fresh, nutritious food through farm-to-school partnership. These partnerships support local agriculture while giving students healthier options. Additionally, I advocate for restricting the sale of marketed sugary drinks and junk food on school campuses. Schools should be an environment that promotes wellness and not reinforce unhealthy eating habits. The second component is evidence-based nutrition education. Nutrition knowledge is one of the biggest predictors of healthy behavior, yet many schools do not include consistent nutrition lessons in their curriculum. By integrating nutrition education across different grade levels, students can learn how to read nutrition labels, build balanced meals, understand portion sizes, and develop lifelong healthy habits. When children understand why healthy eating matters, they are more likely to make a positive choice both in and outside of school. The third component involves expanding physical activity opportunities. Daily physical education should be required, not optional. Additionally, classroom activity breaks, outdoor play, and movement-based learning can help students stay active throughout the day. Many schools are reducing physical activity programs due to budget cuts, but these programs are crucial for obesity prevention. This aligns with the Healthy People 2030 objectives, which emphasizes the importance of increasing physical activities in school settings. The final component of the initiative is building partnership. School cannot do this work alone. Collaboration with local farmers can support fresh food programs, while community organizations can provide after-school activities. Health promotion resources and educational workshop. Public health agencies such as the CDC DNPAO can offer the guidance, data, and evidence based on intervention. When community, schools, and health organizations work together, the impacts become far stronger and more sustainable. On the individual level, there is so much we can do to support initiatives. Parents and caregivers can advocate for healthier food options in their school district, participate in parent-teacher committees, and encourage physical activity at home. Community members can volunteer with school health programs, help organize wellness events, and support farm-to-school markets. Every small action contributes to a healthier environment for children. At the policy level, larger changes are necessary. Communities can push for school districts to adopt stronger nutritional standards, project funding for physical education programs, and expand access to farm-to-school initiatives. Policymakers can support legislation to promote healthier school environments and address food insecurity. By taking collective action, we can create healthier systems and give every child the opportunity to grow up healthy.